patients commonly see us for chronic neck pain, it sort of works out that the upper neck refers all its trouble to the head, and the mid to lower neck refers its trouble to across the shoulders and into the upper back. It's kind of a complex arrangement up there. That patient will often feel muscular tension that extends up through the back of the head, pain that can radiate up into the head. Most of the time, the pain is what we call axial pain, meaning it stays within the neck. You can have patients who have pain on one side, or they can have pain on both sides, but one side is predominant. That's really common. So many patients walk around with constant muscle tension and constant muscle soreness through their neck, across their shoulders, sometimes even into the areas between the shoulder blades, interscapular area. Then you have patients who have more progressive degenerative changes that can lead to narrowing of passages where the nerves are coming from. So now you have a patient with neck pain with all those associated symptoms we've already talked about, with the neck pain, the pain that can be worse on one side or the other, radiating muscle pain that doesn't get better or provides temporary relief. And then you end up with patients who have pain radiating in the arm. We call that radicular pain. And depending on which nerves are affected and which narrowed passageways that are affected, will radiate in different patterns. So there are different patterns to different nerves that come from the neck. And so they find themselves going to massage therapists, physical therapists for soft tissue mobilization, chiropractors for soft tissue mobilization, and it's soft tissue, soft tissue, soft tissue. And they have very short-term symptomatic relief, and the pain comes back, and they get very frustrated. Now, it turns out that there's a reason why that pain is there, and a reason why their muscles hurt, but it's not the muscles that's the primary pain generators. One of the real joys of orthopedic medicine approach to the cervical spine is that we cheat. It turns out that the majority of neck pain comes from the facet joints and ligaments. When you treat the ligaments of the neck, all the muscle pain would go away. All these other referred pain patterns would disappear when you can treat the ligaments appropriately and stabilize these little inherent subtle instabilities. What is done is your blood is obtained, and then it is anticoagulated and it's centrifuged so that you can eliminate the white cell and red cell component of that blood, leaving you with platelet and plasma concentration, and then that is further centrifuged to concentrate platelets. This is your own blood, autologous blood, so that's, you're going to get back what you gave, and that's then loaded into a syringe, and that becomes our injectate, and then either under fluoro or ultrasound or whatever, you can then target these ligaments in the neck with PRP, platelet-rich plasma. And we find that to be even more effective than the prolotherapy. Platelets are really kind of the commander of wound healing, okay? So when you release growth, when a platelet gets exposed to a source outside the blood vessel and the collagen around, it will activate and it will dump all these growth factors wherever it landed. So what you're doing is you're taking that little injection, you're dropping that little needle tip right on a specific structure that you want to strengthen. And when that platelet lands in that environment, it activates, it dumps these growth factors into the tissue, and those growth factors are designed to proliferate connective tissue to heal wounds. So it's going to start to heal. And it turns out that platelets do a very nice job in healing a lot of ligamentous injuries and ligamentous instabilities.